Hello, welcome to Dr.RS channel. This is Dr. Riffat Sadiq. Today I'm going to talk about hypertension or high blood pressure in elderly. As we grow older and older, our blood vessels become thicker and thicker. Along with that, we have other problems which actually can increase our blood pressure. High blood pressure is so common that it's unbelievable. And there are some simple things we can do in our life to actually really control our blood pressure or bring it down. So why blood pressure being normal is so important? What high blood pressure does? A lot of people know that high blood pressure can cause stroke and heart attack. But maybe some people don't know about this, that high blood pressure can also cause memory loss, or we call it dementia. And that dementia is known as vascular dementia. It also can cause eye problems. Your vision goes down slowly, and also your kidney problems. So what happened in high blood pressure? When we have high blood pressure, the blood supply does not go properly to all our organs like brain, heart, eyes, kidneys, and other system. So it is what happened. If we don't water the plant properly, enough water, what happens to the plant? They become, you will see, they will first become yellow, and then they will be really brown, and then you will start seeing the leaves start falling. So plant is dying. So it means that slowly, it doesn't happen right away. If we stop watering the plant, you will see it doesn't happen right away. Plant will not be dead right away. It happens slowly. The same thing happened with our system. If we have constantly having blood pressure, high blood pressure, it means that our system is not, our eyes are not getting enough supply. So slowly, you would not even notice that our vision will start getting less and less, but you would not notice that. Sometime brain, they will get, we call it lacunar infarcts. That means small strokes will happen. People don't notice that. Kidneys damage happen happen in day or so, it happens in months and years. So it's like high blood pressure is extremely dangerous. We need to pay attention, especially when we are becoming older and older, because our arteries, our pipes become stiffer also with age. So we need to start looking into that. Some of the basic things which we can do in our life, which can actually help us. Number one, be your own doctor, have a blood pressure apparatus at home, make sure that you keep record of your own blood pressure, and then you take those readings to your doctor. You would also know that what is the normal range. The top number, which we call systolic blood pressure, should be 130, 120. If it is going above 140, you need to really see your doctor. If the lower numbers are above 85, it means that you are trending to have high blood pressure, so you need to see your doctor. So having a blood pressure apparatus at home is extremely important. It's not very expensive. Some of the insurances cover for that, so you need to have one. Number one. Number two, you need to start avoiding the salt, because salt and sugar, especially salt, it's dangerous. You actually start having the retention of water, and that is going to cause the high blood pressure. So my own husband, he used to have a lot of salt, and then he started having a little bit of a trending upward for his blood pressure. So now his blood pressure is normal because he actually literally stopped the salt. That was only culprit, he had it. So salt is extremely dangerous, and you need to avoid it. Put in your meal less salt. Don't put salt on salad and other things. Avoid, or I would say lessen your salt intake will be very helpful, and it's very easy. Next thing is weight management. If you see that you're overweight, cutting down on your calories, or also salt and sugar will bring your weight down. I heard from people that it's not an easy thing to lose weight, but once you will do little at a time, 1 pound a week or even 1 pound a month, 1 to 2 pound a month. I usually tell people to have a goal for 4 pounds in a month to start with, but still I find it very difficult. But it's little at a time. So you need to see your body, you need to see yourself in the mirror and then see where you are and how you want to do it. Some of the things are not easy. It's easier said than done. So, but we need to make an effort. So weight management is extremely important. The next is stress. I have done a lot of videos on the stress management, how we can manage our stress, but stress actually can cause a lot of medical problems, but one which is on the top is the high blood pressure. You will see that when you are under a lot of stress, you will see that your head and your neck and your heart, you will start having palpitation. That means that your blood pressure is really high. At that time, you need to relax, you need to calm down, you need to drink water, you need to sit down and learn what tricks or what methods can reduce your stress. When I am under stress, what I do is I sit down, I actually try to meditate, some of the praying or meditation or water or washing your face. Some of the little tricks, everyone is different. Every trick doesn't work for everyone. So find out what helps you. So stress management. And then some of the drinks which actually we can avoid it, like all these sodas that we can avoid. It has a lot of sodium in it, a lot of salt in it. So whenever you're drinking anything, you need to see whether it's good for you or not. You see the content of it. And on the top, alcohol. That also, if you can avoid, that's really is going to be very helpful for your body. Alcohol is not, it's going to raise your blood pressure and it's also affect your liver. So alcohol is also, you need to really look into it. The next thing is smoking. Cigarette smoking is also one of the things which can raise your blood pressure. So you need to see how you can help yourself to get rid of the cigarettes from your life. I hope all these tips are helpful for you because doing these simple things may bring a positive change in your life and you can live longer. So I wish you all that stay healthy. Thank you for watching.